Hey y'all, welcome to my series, The Ones That Slip Through the Cracks. So this series is about all of the patients that we see that could have had things be different for them if somebody would have had some airway and oral function knowledge. So case in point, this young child, 7 years old, you can see that the palate is very narrow, very high. You can also see that there are a lot of silver crowns or stainless steel crowns present. If you look a little closer, there's also not enough room for her lateral incisor to come in. And that's what we call blocked out. And so that's also a concern. Came to us because they were going to get a tongue tie release in about 3 weeks and just had a feeling that this wasn't the proper protocol. And luckily, they were able to get in with us and we performed a full functional assessment. And there's going to be other things that we're going to do prior to that release. The release was indicated due to speech concerns. I will talk about the instability with their crossbite. So they have a right side crossbite, and you can see in this picture. So their top teeth go on the inside of the bottom, and so that creates a lot of instability within our body, our nervous system. It kind of keeps us off kiltered, if you will. It makes us be more dominant on one side. And seeing this at this age, 7.5 or so, if it's not corrected soon, we can't really optimize the growth or transverse or the widening of the palate to get that upper part of the jaw out of being locked into the mandible. And so it's really unfortunate to see this, but we have to really, like I said, rewind what the treatment plan would look like for this case type. You can also see in the facial picture how they hold their body. You can see how they have a head tilt. You can see how their head pushes forward. So constantly looking for that feedback, for that grounding. You can also see on the teeth, there is a little bit more plaque accumulation up by the gum line. That's not entirely from lack of brushing or oral hygiene. Excuse me. That's because this child probably can't comfortably keep their mouth closed. So we're going to have to continue to unwind where root cause is coming from, see how they respond to therapy, work with an orthodontist, work possibly with an ENT or an allergist, work with a pediatric dentist. And so if we could have caught this, when they were little, this would definitely be a different story financially, a different story with their well-being, their quality of life. So spread the word. If you see people that are struggling with breathing, airway, dental decay, jaw pain, just at least prompt them or encourage them to see an orofacial myofunctional therapist. Just hear them out, because we could be changing a lot of lives here, especially when these kids don't really know what's going on and they can't really tell you what's happening. Let's speak up for them too.